Good afternoon, everybody. I hope I am audible and visible to you. Yes, thank you, Archana. Okay, so good afternoon, all of you. Archana, Girish, Shobha, Srilekha, Ekta, Jyoti, Madhura, Rukrani, Rinki, Seema, and Sidra. So we're still only 14 of us. Good afternoon, Girish. To begin with, of course, before we begin our session, I would like to tell you certain things which are very, very important. First thing is now we have allotted guides to you, guides or mentors to you. And by guides and mentors, we mean that they will be your supporters. They will motivate you, they'll teach you, they will guide you how to make the thesis. We have already finished one lecture in thesis. So, So these guides are all experienced doctors. Some of them are from Dr. Batra's, some of them are not now in Dr. Batra's, but they will guide you about thesis. So whatever problem you have of thesis, you can talk to them. How the thesis should be made, you can discuss your topics with them. Now, initially in the university, the rule was that the topic should not be repeated, but in skin, as such, there are not many topics, and therefore topics can be repeated. And I would wish that you people who are not in active practice choose some common topics rather than choosing some difficult topics. People who are in practice and who are able to attend Dr. Batra's clinics can choose topics, even difficult topics, but ideally the topic should be first acne. Acne is one of the commonest topics that everybody can, many people can take. Acne, psoriasis, lichen planus, atopic dermatitis, okay, even hair fall in males, hair fall in females, alopecia areata. These topics are common topics, and you will get a lot of cases everywhere. And even if you go to Dr. Batra's clinics, the doctors in Dr. Batra's clinics will help you to give you cases, give you the photographs, to give you the follow-ups. They will help. As far as the corona crisis is concerned, there are some problems now. Many of you are not going out of your homes, you are at home, which is absolutely right. You have to be at home in order to be safe for yourself and your family. But at a certain level, you'll have to come out because we have to finish our course, we have to finish our dissertation. So we have to go to our nearest Dr. Batra's clinic and try to get cases, try to see some patients, because we can't sit at home forever. Remember, now corona has been there for more than 6, 7, 8 months, since February and since March beginning. So April, May, June, July, August, September, October. So it's like 7, 8 months. So we have to face it. We have to take adequate precautions, but we have to start our work. So don't get overwhelmed by the thesis and the clinical album. The only thing is you will require somebody's help to do. As far as help is concerned, I am always there. I'm always there online. You can talk to me whenever you want, whatever you require, I'll help you. As far as cases are required, you have to go to Dr. Batra's clinics, or you can go to any other skin clinic or a homeopathic doctor's clinic where you can sit, where you can share cases, where you can get photographs, where you can get cases. Because your thesis, it requires 30 cases. You'll have to gather 30 cases of your topic, be it acne, be it hair fall, be it psoriasis, lichen planus, atopic dermatitis, whatever your topic is, you have to gather 30 cases with photographs, before after photographs, with follow-up of at least 6 months, and a proper case. Now case can be anything the way you take. It is not compulsory that the case has to be in this pattern or that pattern. You can take the case you want, the way you want. Ultimately there has to be a representation table. Therefore I urge all of you to have one software with you. Either it could be Homeopathic, or it could be ISIS Scanner, or it could be even Radar. But please have some software, because software is useful not only for this course, but later on also when you are in practice, it is going to be useful. So people who are practicing and who have a software, they know how much essential it is for their practice, right? Plus, there are a lot of tips of how to make thesis in various softwares also. Secondly, is don't forget that along with thesis, we have got something called a clinical album, which is a mixed cases, 15 mixed cases. So your thesis will have 30 cases of your chosen topic. So if you have chosen psoriasis, your thesis will contain 30 cases of psoriasis with before after photographs, with proper follow-up and a properly taken case and the repertorization table which is copy and pasted. Okay. Clinical album or clinical assignment is something which contains 15 mixed cases. That means it could be acne, psoriasis, everything mixed. It is like a basket of flowers, mixed flowers. Okay? So mixed cases. That also the same. A case is taken, the repertorization table, the follow-up, and the before after photos. So for your exam, which will be occurring exactly after 1 year of your admission, you have to come prepared with one is thesis, one is the clinical album or the case album or the clinical assignment. Third is the logbook, which is very, very important. These three things are very, very important. Don't get stressed, don't get overwhelmed. Everywhere help is available. I'll be helping you. The doctors of Dr. Batras will be helping you. You can go to any clinic you want, and I assure you that you will be helped. So don't worry about the help. Don't worry about the lectures. All the lectures are going to happen properly. I am trying to give you as much as lectures as possible. Also the good lectures which had occurred in past, remember. Some of them are recordings. I'm still giving you the recordings again because those recordings are really, really very, very good. So many of you might feel, oh, we are getting recordings. These are not live lectures. But remember, why I'm giving recordings is I can arrange live lectures anytime. There's no problem. Live lectures means through webinar. But the idea is that you should get the best. So whatever 5 years I have got the best lectures, I'm trying to keep. I'm also in the process of making a Gmail group or a Google group whereby I can send you video lectures of skin, which we used to record before. Initially, in the first year of fellowship, we used to do a video recording of all the lectures. So we have a lot of lectures on video recording, but video recordings are very, very big, 30 GB, 35 GB. It's a big data, which can go only on WeTransfer. Okay, so WeTransfer can go on the Gmail. So I can send you one lecture on that's my plan. Okay, so I have lots of things I want to do for you, but just try to cooperate. Don't keep criticizing about this and that. The other day I was talking to somebody who was criticizing about the course that hardly there are any lectures. It should be like this. It should be like that. In spite of Corona, I am also traveling every day, 30 kilometers up and down on my bike. I am also taking risk. I'm coming to Dr. Batra's clinic in my office here. I'm trying to do something or the other every day. I'm trying to arrange some lecture here or there for you every day. Trying to give you the best. But still, there are many of us who are staying at home but are criticizing. No, aisa hona chahiye, waisa hona chahiye. No, this is not right. We are trying to do the best for you. Even in Corona, we are trying to do the best for you. I'm trying to arrange lectures. I'm trying to make my own lectures so that I can give you the best whatever I know. All my lectures, whatever skin I have taken, especially in international seminars and international webinars, I am trying to give it to you. So, in whatever level I can give you, I'm trying to do the best for you. I'm trying to bring in the best people for you. And therapeutics is one side of the portion. Yes, therapeutics will be done. You people are interested in therapeutic, but what I'm trying to inculcate you to do is classical homeopathy. It is how to look at the patient. What is his concern? Why has he come to you? Sorry, excuse me. So we have to train ourselves as classical homeopaths. Many a times constitutional remedy is not easy. I agree with you. I have also been in practice for 27 years and I know that constitutional remedy is very easier said that okay, I want to give you constitutional remedy. It's not so easy. Many times it is not possible. That's why today I want to teach you another method of treating skin diseases by just looking at the lesion. Normally we call it lesion, right? Wherever a person comes to us. Right in the beginning, we had talked, and even Dr. Rajan had taken a basic lecture on dermatology, where we had talked about the morphology. When a patient comes to you with some skin problem, you have to look at the morphology. What do you mean by morphology? Is you have to look at it. Just like inspection, palpation, percussion, and auscultation. We had done in clinical medicine. Remember Hutchison's. The same way, when a patient comes to us, first of all, if he has got some eruptions on the hand, you look at it with your naked eye and also have a magnifying glass. It's very, very important. If you are having a good skin practice or if you want to develop a good skin practice, always keep one magnifying glass with you. Wood slab and all those are little advanced things which you can keep later on, but initially you should have at least through your naked eye observe. Second thing is through the magnifying glass. When you see through the magnifying glass, even you can see small white spots also. So pre-vitiligo state also you can find out if a person is going to prone or is prone to be vitiligo later on in his life. You can. Okay, so pre-vitiligo can be found out if you have a good magnifying glass. Inspection, palpation, always try to touch. Don't feel that all the skin things are infectious or contagious. Nothing is contagious, nothing is infectious. You know, you are a doctor. You know that psoriasis, eczema, dermatitis, these are, yes, fungal can be. So be careful with fungal. As such, I don't believe in fungal is contagious because when we are homeopaths, we know that it is our own personal immunity which is very, very important. So touching somebody's fungal infection or trying to palpate a fungal infection or an eruption does not mean you will get a. So inspection, palpation, look at it, look at the morphology, whether it is a macule, whether it macule is something which is flat, right? We had talked on the first day. Macule is something which is flat. It could be hyperpigmented or hypopigmented. Very, very important. So this is your mind should be very clear about what things are happening. When somebody is coming, when a small child is coming to you and he's got white spots here, white spot, and they're quite diffuse. They are not very clear cut. They're diffuse white spots here and there. Don't immediately come to the common diagnosis of a vitamin D deficiency, a calcium deficiency, which is common. It may be like that, but don't always talk like that because parents will know because parents have come to you after going to many other doctors. So if you tell them, this is vitamin D or calcium deficiency, so what the other doctor also said that. So we have come to you for that. So now is diagnosis really important for us? Yes, diagnosis is important because then only the opposite person also knows that you also know skin. You also done fellowship in homeopathic dermatology. You also have done BHMS. You also have done MD. So everybody knows that, right? I hope I am easily audible because I'm just going on speaking, but I don't know the feedback. Okay. Am I audible clearly? Can you please write in the group, please? Girish, Archana. Okay, thank you, Sindra. Thank you, Ifra, Rinki, Jyoti. Thank you very much. Thank you very much. So diagnosis is important. So when the person comes to you, you should first inspect what it is. Okay, this looks like a macule. Macule में क्या क्या आता है? Macule hypopigmented होता है या hyperpigmented होता है? Hyperpigmented macules क्या क्या होते हैं? Hyperpigmented macules क्या क्या होते हैं? Now in hypopigmented macules, look at the age. Age is okay, 5 years, 6 years, 3 to 5 years, 3 to 7 years. What it could be? Not necessarily immediately jump onto leprosy. Okay, it is hypopigmented and it is diffuse, and just touch it and it is diffuse with the skin also. I mean, you don't feel that any roughness is there, any scaling is there. Very, very important to remember. Scaling. Whenever you rub a little bit, if you feel that there are some scales coming out, you're sure what it is. Okay, so now I'm not going to say that. You all people must have guessed what it is. But look at the age. It is 5 to 7 years, 5 to 9 years boy, young boy, chubby boy with white spots. It is simplest. Pityriasis alba. Pityriasis alba. Or tinea. We say Pityriasis alba, but it is whitish. Why alba? Because it is whitish. So it is very, very simple. Diagnose what it is and tell it to the parents that I think this is this. Of course, in homeopathy, whether it is an alba or pityriasis versicolor doesn't make any difference because you are going to diagnose and you are going to treat the patient, right? But still, we have some medicines. If we don't come across a constitution, then silica and calcarea are two important remedies, which I will think, and I have experience in my practice and also from the masters, that silica and calcarea are two important remedies for pityriasis alba, white spots. Okay, so think about this. And if you again see that there is some scaling here, then it is pityriasis versicolor, where there could be some itching, there could be some dandruff, the age is little high. It will not occur in a small boy. It will occur in around puberty age where there is some dandruff coming up. Remember, dandruff is caused by a fungus called, what is the name of the Malacia furfur? Okay, Malacia furfur, dandruff or seborrheic dermatitis. Seborrheic dermatitis is the severe part of dandruff. So dandruff is this scaling, whitish scaling, white spots, white scales coming up, or in your nails, this white things coming. A lot of itching also. So it's very, very important to examine. If the patient is saying dandruff hai, does not mean dandruff hai. It could be seborrheic dermatitis, which is severe dandruff, or it could be psoriasis also. Why this is important? Because management is important. Many people, many girls, many boys, they'll come to us and हमको oil लगाना है, oil लगा सकते हैं क्या, gel लगा सकते हैं क्या? Nowadays there are a lot of styles and trends about putting gels. Now remember, the gels and oils, they make the hair very oily, which is a basic problem to all the fungus. So if you got seborrheic dermatitis or if you got dandruff, which is due to Malassezia furfur, which is a fungus, applying oil will aggravate. Okay? But if you've got psoriasis, oil can be used to just loosen the scales and the scales will come out. So when to give oil, when not to apply oil is very important. What diet to give to that patient is again very, very important. If you give him flax seeds, especially in exfoliative disorders where skin is coming out, maybe it is psoriasis, maybe it is dandruff, too much seborrhea, you could think of giving flax seeds because flax seeds contain omega-3, omega-6 free fatty acids, right? And they are useful, they are good for all kinds of exfoliative disorders. Again, our remedy Kali Sulph, remember, very, very important. Wherever there is exfoliation, think of Kali Sulph. Wherever there is exfoliation, think of arsenic, arsenic or arsenic iode, very, very important. Think of these 2-3 remedies when there is a lot of exfoliation, dandruff. You can even give some Kali Sulph 6x powder in curd, mix it properly and apply it on your hair and keep it for some time and then shampoo if you've got dandruff. This is normal some gharguti ilaj or homemade remedies, but Kali Sulph can be added, very, very important. So this is what I want you to understand, that constitutional is one part of the treatment which we are not neglecting. We are always be thinking of constitutional remedy when the patient is talking. But what the patient talks, how the patient talks, and why the patient talks is very, very important. Many a times, all these three may not be very easy to look at because what he's talking, he'll tell you that I have come with this skin problem, there's too much itching. How he talks, that is also important. Whether he's scared, whether he's angry, whether he's irritable, that is also very important. And lastly, why? Why is he getting this skin problem? What is his pain in the life that he is getting this problem? So this, what he talks, how he talks, and why he talks is very important. In any case, it's not only skin. Skin is important because skin is a mirror of the internal milieu or internal environment. Remember. Today morning, I was talking to somebody from our batch, and she said that I have got many patients with anxiety and stress. I don't have too many skin patients. And I told that doctor that you are blessed. You know why? Because anxiety, stress, depression, schizophrenia, all these mental illness ultimately somehow or the other are related to skin. Either they go into skin or skin goes into them. So effect of these mental illnesses on the skin can be a very, very good topic for her. That's what I suggested to her for thesis. Because psoriasis, you take psoriasis, lichen planus, atopic dermatitis, all are related to stress. Everything nowadays is related to stress. Everything comes up because of stress. And what is stress? Stress is the problems that we have around us. What we call interpersonal relationships. What is interpersonal relationship or IPR? IPR is something that first thing is the one which is surrounding us is our family. For me, my interpersonal, who are my interpersonal relations around? My wife, my children, my father, my mother, my brother, and my sister. These are my interpersonal. That is my family. Out of my family, I come into my professional life where I have got people around me, like my boss or my colleagues, my subordinates, my superiors, and all these people, right? So I interact at home with all these, I interact in office with all these. Then there is something called spiritual and interpersonal and social outside, friends and everything, right? But Remember, the problem in these three IPRs, the main problem occurs in a home. Many a times there is problem happening at home. Remember that. Therefore, it is very, very important to ask the patient whenever he comes to you with any problem, be it skin or be any problem, that first of all tell me who are there at your home and what is the problem going on at home. Tell me your relationship with your wife. Tell me with the relationship with your children, with your father, with your mother, with your sister, with your brother. And that's where you're going to get something. And something is very, very important. There might be some problem between the father and the son. There might be some problem between the husband and the wife. There might be some problem with the children, and the man is getting stressed or the woman is getting stressed, and then she's getting a problem related to skin. So it's very, very useful. Skin also is very, very important because suppression occurs on skin. Knowingly or unknowingly, we do a lot of suppression, like using even medicated soaps, Ayurvedic soaps. Nowadays, there is a style for a lot of Ayurvedic soaps and Ayurvedic oils and Ayurvedic lotions and creams. So many medicated creams are available that we normally use without even knowing. So knowingly or unknowingly, there's a lot of suppression of skin diseases. So this is how you are going to approach. So whether it is a macule or whether it is a papule, if it is a papule, then is it a vesicle? Does it contain some liquid? Does it contain white liquid? Does it contain blackish liquid? Are they spots which are full of blood, or are they full of pus, or are they full of liquid? Are they vesicular eruptions? Are they pustular eruptions? These all come in the category of papules. And when the papule becomes little hard, then it is known as nodule. So therefore, you see this acne in various stages of development. Initially, it could be just redness. It could be maybe a small macule. Then it becomes a papule. Then it gets filled up with pus. Then it's called a pustule. Then it becomes a nodule. Then it becomes a little more and it called cyst. So nodulocytic acne. There are different types of acne there. So a macule, a papule. Macule, I told you, hyperpigmented or hypopigmented. Hyperpigmented could be anything. It could be neva. It could be many other things. Hypopigmented could be tinea, tinea versicolor. Though versicolor means various colors, remember, but versicolor usually will show us as whitish scaly eruptions. If you just rub, then there will be scales coming. But they will occur mostly in the neck area, in the back area, in the chest area, and will be associated with some kind of dandruff. Remember, it's very good. So macule, hypopigmented, hyperpigmented. Then papule. Papule could be pustule, papule, pustule, vesicle, vesicular with small liquids, and along the dermatome, you know what it is, right? It is herpes. So you have to understand what the morphology is. You have to understand what the problem is, because today the method which I'm going to tell you, which is of therapeutics, I have not discovered this method, but I have studied some books and I found out, especially Borek's material and also Clark's material. These are the two books that I think you should read for your exams. And of course, Dubey Materia Medica, though it is quite notorious. And as a teacher, I also used to tell my students, don't read Dubey, don't read Dubey. It's like a guide, it's like a guide. But hypocrisy is that everybody reads Dubey. Everybody reads Dubey, everybody passes because of Dubey, everybody gets some or the other knowledge because of Dubey, but everybody criticizes it. So this is the hypocrisy. So Dubey is good. I have visited Dr. Dubey and I've sat with him and I saw what a classic prescriber, a miraculous prescriber he was. He was very, very old when I had gone. He was maybe 93, 94 years old. He was not able to talk also, but still he had that vision of whether this guy is Nux vomica, this guy is lycopodium. Just when the person used to come and walk, they used to know what the remedy. That is Calcutta method. So I would always advise you, one of these days I had a dream that with the fellowship course, we should all make a group and we should all go to Calcutta. Just like in our colleges, there was a pharmacy tour. The first year students, they used to go to a pharmacy tour and watch how the medicines are made, the homeopathic medicines, the trituration and potentization, big factories like SBL and Schwabe and Vaccine and all that. So my feeling is that we should make all of us make a group. We go to a particular doctor, we sit with him, see how he diagnoses, see how he prescribes, and that would be the ideal, kind of a training in this fellowship course, which of course I'm trying to do. Maybe this batch or next batch, I don't know, but I'm trying to think of it. It's a very good idea that everybody, all of us are sitting together with one doctor, and then he prescribes, he tells us how he prescribing. It will be a great thing. Okay. So we saw the morphology. So let's look at the presentation. I will just show you the presentation. I hope the presentation is seen. Can you all see the presentation? Okay, so we have now some 24 people. Still we have got less people. We don't have all. Okay. Sweet. So dermatology therapeutics. So as I said, case taking in dermatology, first of all, the morphology and clinical diagnosis, in which I told you, inspection, palpation, percussion, auscultation is not there, but inspection and palpation is very, very important. Try to touch, try to see what's happening. Morphology, whether it is in the form of a ring, whether it is a ringworm, whether it is tinea, which part it is affecting, whether it is in the groins, whether it is in the folds, whether it is behind the ear, whether it is the nails, whether it is the palms, front of the dorsum of the palms or the back of the palms, whether it is the soles. So these locations are very, very important when we are talking about location in materia medica, the Borix materia medica I was talking about. So morphology and clinical diagnosis is very, very important. When the patient comes to us, first of all, see what the morphology is, try to diagnose what it is. Second is try to go for ailments from. Where does all this come from? When did it start? 2 years back, 3 years back? What happened? How did all this start? Did it start suddenly? Did it start from one part and went on to another part? Did it start on the right side, went on the left side? Whether it started in the leg and then it came up. So ascending, descending, right side, left side, this is very, very important. Then, of course, you know the analogy, doctrine of analogy by Dr. Boningos, location, sensation, modality, and concomitant. One complete symptom, right? So location is very, very important. If you are going to practice locally, remember, now I'm not saying by local practice, I don't mean specific. We are talking of therapeutics. Now, therapeutics is not specific. We are not just saying, okay, ये दे दो, ये दे के देख लो, ये दो तीन mix करके दे दो, नहीं. We are going to give only one remedy. So we are going to give kind of constitution only for that particular part. Okay, because that part is affected. No, we are not looking at the whole individual, we are looking at the part. So, but we are still doing a classical job. We are not doing a copy paste job. So location. Now, where is the location? Look at where the location of the skin problem is. Second, ask what is the sensation. Normally, the sensation is itching, right? Most of the people are going to come to you with itching, but there are other people who will come to you with burning. There are other people who will come to you with a lot of other pains called stinging pains, burning pains, stitching pains. Sensation as if hidebound. ऐसा लग रहा है कुछ खींच रहा है अंदर. So it's not always itching. Itching is the prime important sensation, remember, of most of the skin problem. But there are other sensations also. So look at ailments from location, sensation, modalities become very, very important. Aggravating and ameliorating modality. And you know, aggravation modalities are always important, more than better modalities or ameliorating modalities. But in skin, both of them are very, very important. Concomitants, very, very important. Along with this skin problem, is there any other problem which is occurring at the same time? Is also very important. And lastly, of course, change of mental state. I mean, I become very irritable since I have got this skin problem. I just shout, I want to be alone, I don't want to be disturbed. This becomes a change of mental state. So therefore, we are talking of concern. What is the concern of the patient? कि इससे आपको क्या हो रहा है? इससे आपको क्या दिक्कत हो रही है? How is this problem affecting? These are some of the questions that you should ask all your patients. Number one is, you are coming to me with some problem. How is this problem affecting you? How is this problem affecting your daily routine? How can I help you? What is this problem? Where is this problem coming from? And what is your concern? आपको क्या तकलीफ हो रही है? नहीं, मैं ऑफिस नहीं जा सक रहा हूँ, मुझे ऑफिस में काम नहीं होता है, मैं काम करते करते मुझे खुजली आ रही है, बालों में खुजली आ रही है, हाथों में खुजली आ रही है, मैं काम नहीं कर सकता. I cannot work. So his concern is work. Are you getting it? His concern is work. He is not able to work properly. So you can come to a group of remedies where work becomes very, very important. It's not a family. Are you getting it? So there are these concerns. So ask the concern of the patient. Look at what he is doing for the problem. इस तकलीफ के लिए आपने क्या क्या किया? Since you have got this problem, what have you done? No. Like for example, I tell you an example of a patient who had a big abscess. Okay, big abscess in his gluteal region. And he could not sit also, and he was sitting like this in front of me. And I said, okay, tell me what. And he was smiling all the time, laughing, smiling. And I said, what is your problem? He says, I got an abscess since 15 days, sir, but I don't know, and it is increasing and it's painful. I said, what did you do for it? No, I did something here. My wife brought some medicine from that doctor. My mother went there, and from that Baba, she got some something to apply, and we applied something, but nothing happened. And I saw, when I looked at his abscess, it was red and it was big and it is full of pus. So this man's concern was somehow, चलता है नहीं होगा तो क्या है, whatever my wife is looking after, my brother is looking after, I don't want to take any tension of it. That was his main thing, right? So his attitude, what was his adaptation? How was he adapting? How was he reacting to this illness? By his frivolous attitude. He was quite frivolous. And he came to me and he said, I came here because my wife told me, because she got well here, so I came here. You do something for me now. You do something fast. So only on two rubrics I just took. One was carried desire to be fast, and second was frivolous. Based on this, I gave him belladonna and his frivolous attitude. Totally non-serious attitude. And with one or two doses of belladonna 200, this abscess hole ruptured out and he was absolutely so case taking is always not 2 hours or 3 hours. Case taking can be even 5 minutes, 10 minutes. Just very, very important is observe the patient. Look at his concern, look at his adaptation. Concern is what is affecting him, what his illness is doing to him, how his routine is affected due to this illness or due to this skin problem, and the way he is reacting, what he has done up till now. This is adaptation. Okay, so I hope that makes a little sense to you and you will be able to use this in your practice, right? We also see in the method of HHM, right? This is what I have learned from HHM. I am also a learner. I am learning from HHM. And since I started applying their method, I started knowing all this and it has become much more easier, right? So location, sensation, modalities, concomitants, and change of ventilation. This is very, very important. So remember these things in case taking. Okay, this is very, very important. Next, we'll go to the remedies, right? So one of the most important remedies in skin is graphites. Okay. Now, as I told you, think of what did I tell you? I told you clinical morphology and diagnosis. Okay. So what illnesses graphites you think of? Okay, I think of graphites in eczema. I think of graphites in dermatitis or atopic dermatitis. And what is the location? The folds. Remember clinical morphology. Let's go behind and I'll see morphology and clinical diagnosis. Ailments from, okay, lot of suppression of skin ailments and this and that, whatever. Location, all the folds. So whenever a person comes to me with some problem in the folds of the skin, be it in the elbow, be it in the axilla, be it behind the ears, be it under the breast, be it in the groins, wherever there are folds, I will think of graphites as the first one. Very, very important. Don't forget this. Folds, graphite. There are other remedies also. There could be soranum also. There are many other remedies. But what we are today thinking of is the prime remedies. First remedy I'll think of is graphite. Sulfur will come everywhere, remember. Sulfur will come everywhere because sulfur is a king of antiseptic. So graphites will come as far as folds is concerned. Folds hoga, first remedy I'll think of is graphites and of course soranum. So this is location. So rawness in the bends of the limbs, groins, neck, behind the ears. Eruptions oozing out a sticky exudation. Now this is the second point. It can't be dry. Remember that graphites can never be dry. There are eruptions in graphites that are dry also, but mostly, again I'm telling you, it has to be sticky. The patient, whether it is fungal eruption, whether it is dermatitis, whether it is any kind of eruption, the name is not important again. The name is not important. The importance is that it is in the folds and the discharge is sticky, sticky, sticky. The discharge is smelly and sticky. The other day I had a lady who came up with a lot of fungal infection in her axilla and she had a big fungal patch and she said that whenever I touch it, it is very sticky exudation, sticky exudation. And she had a tendency to suppuration. She said every little injury, whatever I get, it doesn't heal very fast and it suppurates. On that basis, I just gave her graphite 30 and it really worked. So this is very, very important. Look at the location. look at what a discharge is. Also the discharge, whether the eruption has a discharge or no discharge. So rawness in the bends of limbs, groins, neck, behind ears, eruptions oozing a sticky exudation, unhealthy skin. Every little injury suppurates, just like heparsal. Every little injury suppurates. Ulcers discharging a glutinous fluid, thin and sticky, honey-like, honey-like. Remember, that's what we knew from Dubé's Materia Medica. Honey-like discharge and eradicates tendency to erysipelas. Very, very important. So now, if you go through this pattern, okay, now you go through this pattern. If you know the diagnosis, ailments from location, sensation, discharge, and some modalities here and there, then you will be able to come to the remedy direct. Okay. Next remedy, Proton D. Now, Proton D also known as Jamal Gotra. Right in the beginning, it has an elective affinity for skin of the face and skin of external genitals. So location will get. We are very clear that okay, when somebody comes with some problem with the face and the external genitalia, I'm going to think of Proton D. What are the common problems of the skin? It could be any infection, it could be herpes, it could be genitalia, which could be fungal infection, right? Pustular eruptions, especially in the face and genitals, with fearful itching, followed by painful burning. Again, not a very common symptom, not a very characteristic symptom, because normally when there is a lot of itching, it is followed by normally burning, whatever eruption. But what is important is problems during summer. So ailments from summer complaints. Ailments from summer. So we have got ailments from summer, location, skin of the face and external genital. And what is the sensation? Arey doctor, ऐसा लगता है कुछ खींच रहा है. There is a pulled inside. Feels as if hidebound. Hidebound sensation, as if pulled. Intense itching, but scratching is painful. The patient will say this. We had many patients in our lifetime practice. We have seen that patients come and say, "अरे खुजली करके तो बहुत दर्द होता है, but दर्द ऐसा धीरे-धीरे करेंगे ना तो बहुत अच्छा है." Meaty khujli, they call it, right? Especially in villages, people coming from village side, they say meaty khujli hai. That means it's like a sweet itching. It's especially in fungal eruption. You know, fungal. Most of us we have suffered from fungal eruptions here and there, sometime in our life, right? And we know that fungal eruptions, it's always slow kind of itching makes it better. So there is alternate itching and scratching, feels tight all over, and the most important thing is I should have marked it important. Better by gentle rubbing. Aggravated by scratching, but better by gentle rubbing. The patient always say that I feel better when I gently rub the part. I get aggravated when scratching, but I feel better with gentle rubbing. So remember this modality of Proton D. And Proton D also belongs to or is related to rust family, you know, the Anacardiaceae family. Why? Because Proton D and rust family or Anacardiaceae family have a tendency to form vesicular eruption. They are basically irritants. So the juice of Proton D or the juice of Anacardiaceae family, any member of the Anacardiaceae family, when it falls on the skin, causes a lot of irritation, inflammation, and vesicular eruptions. Remember I told you about morphology. Now if you think of morphology, vesicular type of eruption, you know either it is Anacardiaceae family or Proton D. It could be Anacardium, it could be Rustox, it could be Rus glabra, Rus venata, all types of Rustox, Rus venata, Rus glabra, Rustox, Proton D, even Epis, vesicular eruptions, remember. So whenever you see, look at the morphology and you can think of the drug. Whenever you think of location, you think of the drug. Whenever you look at sensation, think of it. So this thing makes your task very, very easy. Okay. Like today morning, Dr. Sujit sent me some pictures and it was the palms and the soles and he said there's a lot of itching and cracks. And the first remedy that I'll think of for palms will be petroleum. I'm not saying that petroleum is always there, but the first remedy should come to my mind is petroleum. Yes, after that I will think, I might go to the repertory, I might say here, I might say there, but the first remedy that comes to me when I talk of palms is petroleum. Palms and soles, petroleum. Palmoplantar psoriasis, petroleum. Think of that first, okay? Similarly, when there are vesicular eruptions, I'll think of Rustox family, I'll think of Proton D, I'll think of Epis, I'll think of Cantharis. These are all for vesicular eruption. I might also think of ranunculus bulbosus because they are all good remedies for herpes zoster. Because herpes is vesicular. So now whether you call it herpes or whether you talk of general vesicular eruptions, your task becomes very, very easy. So this lecture I have specially prepared so that your task in treating skin diseases become very, very easy. Okay. So Proton D. Okay. But don't forget that summer complaints, affection of the skin of the face and the external genitalia or the scrotum, and the most important thing is the sensation as if hide bound. अंदर कुछ खींच रहा है ऐसे लगता है, as if somebody is pulling. Scratching is painful, but better by gentle rubbing. Very, very important. Proton. Okay. Next remedy is Condurango. Now Condurango again, where is the location? Here, mucocutaneous junction. Do you know which is the other remedy for mucocutaneous junction? Nitric acid. So nitric acid and Condurango are the two remedies where they will affect the mucocutaneous, the mucous membrane and the skin meets. Mucous membrane and the skin meets. So cracks at the corner of it. But when? In the ulcerative stage of carcinoma. Remember that. Condurango is a more or less a specific remedy for CA of the stomach when the concomitant is painful cracks in the corner of the mouth. Very, very. So painful cracks in the corner. So now we have location. Again, go to that chart. Go back and think about what did I tell you before? Clinical diagnosis of morphology, ailments from location, sensation. Either location kya hai? Location is the mucocutaneous junction or corner of the mouth. Sensation is painful cracks. Diagnosis or clinical diagnosis, epithelioma or cancer of the stomach. These are the diagnoses, right? It's a very small remedy. It is a very specific remedy. Can be given especially in CA stomach when there are painful cracks in the corner. Okay. Next remedy, petroleum. Now, king of our skin therapeutics is petroleum. Many, many symptoms are there. But where it is acting? Mostly on the sweat and oily glands. Remember. What does it do on sweat and oily glands? It causes decreased secretion. Remember, petroleum is more or less a dry remedy. It is not a remedy which causes a lot of secretion. Even Natramur acts on sweat and oily glands. But what is the difference between Natramur and petroleum? Natramur causes excessive secretion of oil, and therefore you see skin of Natramur is very, very oily skin. Therefore, Natramur is an important remedy for dandruff. They have a lot of dandruff, whitish dandruff, powdery dandruff, oily dandruff, lots of dandruff for petroleum. Natrum is also an important remedy for acne. Why? Because of oily skin. So if you are able to understand this way, the morphology, the clinical diagnosis, and the particular remedy, it becomes very, very simple. You have to know where the remedy acts. Remember, if you have to practice in this local method or the therapeutic method, you have to know the sphere of action of every remedy. And therefore, I would like you to study this. Go back to your books, find out the sphere of action, find out how it acts. So therefore, I talk of Dubey because Dubey sir in his book has written sphere of action and pathogenesis. That means petroleum acts on the sweat glands causing decreased secretion of glands, or Natramur acts on sweat glands causing increased secretion. Even Soranum also. I'll just show you. I'll just show you something. Since you are able to see my screen. See, this Materia Medica, Boris Materia Medica is free on homeoint.org, right? So if you look at Soranum here, I hope you can all see the screen. Soranum. Offensive discharges, filthy smell, and these blue letters, my friends. Can you see these blue letters? Can you see the italics of Boris? These are the most important symptoms. If you read Boric every day, 1 or 2 remedies, and just remember these blue letter or italic symptoms. See, raw red oozing scabs around the ears. This is also a drug which acts on the folds. Remember, just like our graphites. Okay. Herpes from temples, offensive discharge from eczema around ears, intolerable itching. Most fetid pus from the ears. Okay. See, dirty dingy look, intolerable itching. What is written here? Sebaceous glands secrete excessively oily skin. Getting the difference? What Soranum does, it acts on the sebaceous glands, oily glands, and secretes more oil, causing a lot of oily skin. Whereas when you look at petroleum, skin is dry, constricted, very sensitive, rough, cracked, leathery. Can you see this? There is no oiliness. The oiliness is gone. Therefore, they are thick greenish crust, burning, itching, redness, raw, cracks, they bleed easily. If you look at extremities, tips of fingers are rough, cracked, fissured everywhere. Therefore, it becomes a most important remedy for palmoplantar psoriasis. Therefore, the first remedy I will think of for cracks, and especially if the tips of fingers are involved, I'll think of petroleum. So don't forget petroleum. And as I have told you, both petroleum, soranum, and natramur, they all act on sebaceous glands, oil glands. But on petroleum, it causes dryness. On natramur and soranum, it causes a lot of oiliness. This is very, very important. Don't forget this, and this will be very, very useful to you in your practice. Remember, very, very, very important. See here also eczema, intertrigo, in and behind the ears. So this is also a remedy which is acting on the folds, right? So we have some remedies which are acting on the folds of this. Okay. Okay. So petroleum, very marked skin symptoms. Acting on sweat and oil glands, skin is dry. Remember, dry, constricted, very sensitive, rough, cracked, leathery. Also, it is an important remedy for herpes. Slightly scratch makes skin separate, like Hipparcel. Intertrigo, that means you know that pustular in between the folds, right? Psoriasis of the hands, thick greenish crust, burning and itching, redness, raw, cracks bleed easily, eczema, raggeds, worse in winter. This is very, very important. Petroleum is always worse in winter. As such, psoriasis also, many patients are aggravated in winter, better in summer. But petroleum also has this symptom worse in winter. So never ever forget the location of petroleum. There's the palms and the tips of the fingers. Very, very important. Cracks, dryness, leathery, they're very, very dry, and cracks. Very, very. Okay. So you will not forget petroleum now. Petroleum is also acting on folds, just like graphites, right? Another very, very important remedy is Mesarium. Don't ever forget Mesarium. And what is the characteristic of this book, either Boric or Clark? I was telling you now. If you go to Clark, I will just show you Clark. See, this is Clark. Okay. And if you're looking petroleum, see, always Clark starts with first the name of the remedy, then the common name, then what is used, whether trituration or tincture, then clinical. This is very, 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 very important. All of you should study this part of Clark and the characteristics. You don't need to read the particular symptoms because they are more or less like every other remedy. But what is important is the characteristics. Okay, so look at certain things. Ear affections of eczema, face rough, feet soles painful, fester tendency. Okay, hands are chapped. These are all are characteristic symptoms. See, even psoriasis is given in italics. Skin affections of warts. So see all these things. So once you know what clinical, so many times you will prescribe clinically on the diagnosis. Okay, psoriasis, and it is dry, leathery, cracks. You will give petrol. So it is very, very clear. So this part of Clark, bacteria medica, is very, very important. Look at the italics. That will tell you. Now diarrhea, it is a good remedy for diarrhea, but diarrhea after what? Cabbage. Eating cabbage or eating sauerkraut. Sauerkraut means what? It is a salad made from cabbage and other sauces. It is not in India, but it is made abroad. But for us, it is important. Any problem from cabbage, you can think of petroleum. Okay. So remember, this is very, very important. So even all indications are given. See, ear, affections of ear, eczema. So anything around the ear, you know, remedies like petroleum and graphites. Okay. Feet and soles are painful. Herpes is there. Hands are chapped. Irritation is there. Perspiration offensive. Psoriasis is there. Skin affections of and warts. Okay. So you'll never forget. Once you study like this, you'll never forget. Okay. Mesarium. Mesarium is a very, very important remedy for all kinds of skin eruption. Mesarium is also known as vegetable mercury. Remember. Therefore, it has all many kinds of syphilitic symptoms. So it has eczema, which is too much itching. So itching is the most important symptom of Mesarium. When the patient comes to you with whatever skin problem and there is too much itching, and itching is along with chilliness, he feels even cold also. With itching, there is a lot of coldness. Think of Mesarium. So eczema is a diagnosis. Intolerable itching is a symptom. Chilliness with pruritus, worse in bed. It is also used for varicella, but it is also used for shingles or herpes, right? So where the ulcers are itching and burning, surrounded by, see again the morphology, vesicles, shining fiery red areola, zona with burning pain. So think of Mesarium in herpes zoster, think of Mesarium in eczema, think of Mesarium in psoriasis. But what is important is that wherever there is an ulceration or wherever there is an eruption, there is a crust formation. When you remove the crust, there will be a lot of pus inside. Like if the patient is coming to you with eczema capitis, a small child coming to you with a lot of eczema or tinea capitis, if you slightly remove the crust, you will see that there is a lot of pus inside. And think of Mesarium. So there's a lot of itching, he'll scratch all over, and there will be a lot of pus, and that pus will be covered with thick scabs. Very, very. So Mesarium has a lot of itching. We'll just see Clark. I will show you again. I would like you to see Clark again for Mesarium, and then you will understand why Clark I am referring, so that it will give you a better understanding. Now we look Mesarium here. Mesarium. See, I told you it is syphilitic, right? I told you it is a vegetable mercury. So the first thing written is bones, whenever the bones are affected. Toxicotinea, Cresta lactea. You know, I told you about these small children coming with a lot of pus everywhere. Pus and eruptions, Cresta lactea. Ear affections, erythema, herpes zoster. We talked of zona. We talked of impetigo, irritation, pityriasis. So pityriasis alba or pityriasis versicolor. Tinea capitis. Didn't I tell you just now? Tinea capitis, tinea versicolor, where there is a lot of itching. So a patient coming to you with fungal infection when a lot of itching is there, or a child coming to you with tinea capitis where there is a lot of fungal infection and you remove the crust and you see a lot of pus accumulation, and there is a lot of itching and burning. Think of Mesarium. Please don't forget Mesarium. Just go quickly to the skin particulars and we see sensitiveness to the touch, general desquamation, itching especially at night, more violent and painful after scratching the parts. Ulcers with an areola, sensitive, easily bleeding when removing the linen. So much so that there is an ulcer, then the linen will stick. You have a bed sheet, it will stick, and when it is removed, then there is a pus under. So there is a lot of burning and sticking pain, right? A lot of quantity of pus under the. So that is what is Mesarium. Okay, so I hope that makes you a little clear. Okay. Next remedy, the famous remedy is Rustox. Now Rustox, I told you. What did I tell you? Rustox comes from the anacardiaceae effect. Rustox also known as poison ivy. Why poison ivy? Because whenever hunters used to go into jungle and when these leaves used to come in touch and their juice used to come in touch with the hands or legs, it used to cause tremendous irritation, burning, and vesicular type of eruption. Vesicular type of eruption. Therefore, Rustox family is all famous for vesicular. Now, imagine which type of these vesicular eruptions are there, and most important is herpes zoster. Therefore, Rustox becomes more or less #1 remedy for herpes zoster because that is in the pathogenesis, right? Rust causes vesicular eruption, therefore rust cures vesicular eruption. That is similar curative. So red, swollen, itching, intense, vesicles, herpes, urticaria, pemphigus. Remember when the bulla, pemphigus, you know that there are small bullae or big bullas. When there are small bullae, you could think of Rustox. But when there is a big bullae, you think of Rus venata, the brother of Rustox. Rus venata is for big kind of boils like this, you know, big bullae or big pemphigus. Rustox is for small, and small vesicles are nothing but who has herpes, vesicular eruptions, right? So Rustox is an important remedy for vesicles, herpes, urticaria, pemphigus, cellulitis. It also causes irritation of the skin and edema of the skin, causing cellulitis. Therefore, it is very close to arsenic. Okay, for cellulitis. Rus venata, as I told you, itching which is better by hot water. Vesicles are big, erythema nodosum, nightly itching, and pain in the long. So don't forget Restox, Rest Veneta. Next, of course, our remedy again for herpes zoster, one or more specific, ranunculus bulbosus. Burning and intense itching. Normally, ranunculus has herpes along the chest, right? So that is the sphere of action. I was telling you about what is the most important sphere of action, right? So again, I will show you. Go to boric and we see ranunculus. So that will tell us where is the location. See, acts especially upon the muscular tissue and the skin, and its most character effect is on the chest wall. Very, very important. So anything, any skin eruptions along the chest wall causing a lot of pain and a lot of vesicular eruption, which is commonest in herpes zoster. Pleurodynia, that means pain in the chest. Okay. Think of ranunculus bulbosus. Ranunculus also for spasmodic hiccough. Again, spasmodic hiccough because of the irritation of the diaphragm, right? Burning and intense itching worse by contact, herpetic eruption, shingles, bluish vesicle. So it becomes more or less a specific for shingles. Remember, herpetic eruptions, even for post-herpetic neuralgia. Don't forget ranunculus bulbosus. People from many places they'll come to you and say कि जब से मुझे herpes हुआ था, अभी herpes तो चला गया, but वो pain अभी भी बहुत होता है. Think of ranunculus bulbosus. Of course, another very important remedy which I would suggest is Mesarium also for post-herpetic neuralgia. Okay, I'll just show you again Mesarium. So various kinds of pains with chilliness, sensitive to cold. Patient is very, very sensitive. So it's an important remedy, right? So that was ranunculus bulbosus. Also used for corns. Remember, ranunculus is also very important for corns and especially fingertips and palms are chapped, just like petroleum. So it's an important remedy for corns. Think of ranunculus for corns, just like which is the other more or less specific remedy, antimony crude for corns. Remember, so very, very important. That's ranunculus. Just we'll see what our Master Clark says for ranunculus. See, clinical for it's a very important remember a remedy for alcoholism, bad effects of alcoholism. So maybe a person who takes a lot of alcohol and maybe next day comes up with a lot of herpes, you would think of ranunculus bulbosus. So alcoholism, breast pain below, chest pains inside, delirium tremens, okay, neuralgia, very important. So don't forget this, okay? And it was proved by a German physician called Franz. Remember Franz. Pain during inspiration, very important, because the the pleura is affected, right? So please read this book. Please read this book. It's a very good book. At least try to read this first three things. One is clinical, second is characteristics, and third is relationship, and fourth is causation. At least read this much, because the other things you can read from other books only, but the most important is these four things. Please read this. Okay? Next remedy is agaricus. Agaricus, you know, is a very important remedy for chilblains, especially when you go out in the cold weather and your tip of your fingers have become very cold, but after some time they start burning. Then it is known as Raynaud's phenomenon. You know what is Raynaud's phenomenon, right? So burning, itching, redness, and swelling as if frostbite. So people who are sensitive to cold air can even get this frostbite like things even in this weather also. You don't have to go into a very icy cold weather to get frostbite, because in icy cold weather, frostbites or Raynaud's phenomena is normal. But people who are very sensitive to cold can get these feelings even in our patients also. We can get many patients who are like this, right? So this burning, itching, redness, and swelling as if of frostbites. Another remedy is zincum metallicum, also for important for chilblains, right? So chilblains, angioneurotic edema, rosacea, swollen veins with cold skin, circumscribe, erythematous, papular, and pustular. See again, morphology is there. Papular and pustular with edematous. Okay, so that is again. Next, very important is antimony fluid. Okay. I think till now everything is clear. Do you have any questions? Please put it on the group or put it on the chat here. I'm just looking at the questions. If you have any questions, please put any questions. Okay. If someone says, Meru has asked, if someone says only cosmetic issue, this psoriasis skin looks ugly, rest I don't have any problem. What should we say? Now you only tell me, Meru. If somebody is so much concerned about the skin, see, remember psoriasis skin looks ugly, that is situational. Okay, it is really looking ugly. It's not that it is a very small eruption, and then if she says that it is looking ugly, then it is characteristic. But if the whole skin is affected and it's look ugly, in a way she is right. But you'll have to look at the more deeper feelings. Why she is talking of ugliness? Does she have any other issue? Because whenever a lady talks of being ugly or I don't like myself or I look ugly, there is some issue of abuse. Remember, abuse in the childhood. It could be verbal abuse, it could be physical abuse, it could be even sexual abuse. So it's very important because this statement itself that I think I'm ugly, I look ugly, I am not good enough would take you to remedies like lack canine. Whichever feeling that they are dirty, they are ugly, they are not good enough. Even remedies like Hura, which are coming from the leprosy mice. Okay, so you have to go deeper into this. You cannot just remain superficially on this. You have to find out deeper history. I hope that clears your doubt. Mary. Are there any other questions, please? If you have any questions, please ask. You can even open your mics and talk to me if you want, no problem. Whenever you want to, you can unmute and you can ask me any question. Okay, so the next very important remedy is antimony crude. Now, I was just reading today Fatak and I was really happy to read what I had read many years back. That antimony crude patient is a crude, mentally and physically. The patient is a gross feeder, a glutton. He eats beyond his capacity of digestion or without discrimination, and therefore the mental and skin symptoms are due to gastrointestinal distress. So very nicely given. You know, in our school days, I remember even during some functions also there were some people who used to eat a lot of laddus. You know, and there was a competition. A person who can eat 50 laddus, who can eat 100 laddus. And these are the antimony fruits. That they go on eating, and they beyond the capacity of digestion. After that, they develop some problems. One of my teachers also used to tell me antimony crude is for bad effects of eating Chinese food. You know, the Chinese food is spicy, sour, and sweet. You know, it is a combination of spicy, sour, and sweet. And one of the cravings of antimony crude is craving for sour, acids, and pickles. Remember? So antimony crude people usually like Chinese food. The Chinese, which the Indian Chinese. I mean, I'm not talking about the authentic Chinese because authentic Chinese is totally different, and most of us cannot eat authentic Chinese because it is not so tasty. But the tasty is the Indian, the people which the Indian people which make Chinese food, the Indian Chinese food. That is a combination of spicy, sour, and even the sauces are like that. You know, so if you eat that too much and you get a stomach disorder, more than nux vomica, I think antimony fluid will help. So anything which comes because of gastrointestinal disturbance, think of antimony. Now, where again antimony fluid acts? So it is very clearly written that there is a tendency to formation of cracks in the canthal, nostrils, angle of the mouth. So again, like a mucocutaneous junction. Therefore, antimony crude also like Condorango will be good for cracks. Just like nitric acid also it will be good for cracks. So three remedies where cracks will be there is antimony crude, nitric acid, and Condorango. Of course, Condorango is much more deeper acting. It is along with C of the stomach. Antimony crude is more superficial drug where it can cause cracks in the canthi, nostrils, around the mouth. There's a lot of eczema with gastric derangement, pimples, vesicles, pustules. This is the morphology. Remember, we talk about morphology. The morphology. They are very, very sensitive to cold bathing. Therefore, they say river water bathing. Remember, whenever we go out for picnics and all, antimony is a good remedy for picnics. You know, when you go out for picnics, especially you walk a lot on the summer, you're trekking, and then you take a river bath, and then you eat also too much. You eat too much, you have a river bath, and after that you get a bad headache or stomach problem. Think of antimony. So they are sensitive to cold bathing, cold water, summer. It also has thin, hard, honey-colored scab, just like graphites. It's also an important remedy for urticaria. But whatever the skin problems, they have to come because of stomach problem. Remember, overeating and then some skin problem, just like pulsatilla. Pulsatilla has also problems coming from stomach. If the stomach is overloaded, stomach is disturbed, then they might get something. But pulsatilla, it is stomach problem itself that will give pulsatilla. But antimony fluid, not only stomach problem, but even skin. Okay. So dry skin, it's also an important remedy for warts. It has a lot of psychotic manifestation like warts. So thuja, sabina, costima. Scaly pustule eruption with a lot of burning and itching. Nails, very, very important. One of the most important remedies that you will think for the pathology of nails. If the nails are distorted, nails are hard, nails grow very fast, nails grow very thin, nails they break off easily, they are hard, crumpled, horny nails, horny warts, think of antimony. So any patient who complains of a lot of nail problem, think of antimony. Of course, there are other remedies like silica, other remedy like thuja, where nail is involved. But think of antimony crude. If you are thinking of problems of nail, when the nail has become thick, cannot be cut properly. So it is a good remedy for fungal infection of the nail. Onychomycosis, remember, very, very important pathology. The patient comes to you with onychomycosis. Think of 2, 3 remedies like antimony crude, thuja, silicea. Very, very important. All three are important for fungal infections of the nails. Right? So nails are brittle, they grow out of shape, horny warts on the hands and so tender that they cannot walk. Very, very important. Very, very tender cords. Antimony crude, again, #1 remedy for cords. They're very, very painful. And the patient says, I cannot even walk on the ground. I have to walk like this, keeping my leg like this. Because if I slightly press it, there's a tremendous pain. So feet are very, very tender, covered with large horny places, inflamed corns, and pain in the heels. Now, pain in the heels is not because of the corns, right? Very, very important. Just look at what Clark says in antimony fluid. Sure, will give us some good understanding of antimony fluid. See, anus irritation of callosities, diarrhea, dyspepsia, eczema. Feet are sore and horny. See, it is given in italics. Feet is sore. So any problem at the level of feet, think of antimony. Just like petroleum. Remember, I told you, feet, sole is involved. If there are cracks, think of another remedy for cracks of the sole is CPI. Remember, CPI and sarsaparilla. So any woman or a man who comes to me with cracks in the soles, I will think of 3 remedies. #1 is antimony crude. #2 is CPI, but CPI is especially the heels. Remember in the advertisement, in the TV advertisement, they show a lady doing yoga and her heels are cracked. That is CPI. Heels are cracked, and that also especially in winter. And the third remedy is sarsaparilla. So I will just show you the magic here. If you look at, let's look at sarsaparilla. Let's see. Let's go back and see whether Clark has also given feet in sarsaparilla. Hands tapped he has given. And it is in alphabetic. So A, B, C, D it is given. So hands are chapped. And if we just go and look at the soles, the lower limbs. So he has given only the symptom painful sensibility of the soles, deep ragards on skin of fingers. So remember a lot of fungal infection and cracks in between the fingers, you would think of sarsaparilla. It's not only a urinary tract remedy, but also an important for skin. Remember, for herpes, gravel, of course, you know, sarsaparilla is a good remedy for stones, right? Right-sided stones. So think of sarsaparilla for. So antimony crude, don't forget that he's crude mentally, he's a glutton, he eats a lot. And when he eats a lot, he gets problems because of the skin. And also the fingers are affected, the nails are affected. Cracks in the corner of the mouth, canthi, nostrils. Bad effects of river bathing or cold water bathing or summer, very, very important. warts and corns, which are very, very painful. Corns which are very, very painful, especially on the soles. So don't forget. Next remedy is our honeybee. And you know, honeybee also has a tendency to form vesicular eruption. But what is the characteristic is the stinging pain. Epis is also, I have also used Epis in a lot of herpes zoster cases where the pain is stinging pain and the pain is better by cold application. Okay, so Epis smell is a very, very important one. When there is a lot of swelling, redness, and puffing of various parts. There's a lot of edema, red, rosy hue. Stinging pains, don't forget. The most important thing of Epis is stinging pains. Intolerance of heat, intolerance of touch, and afternoon aggravation, 3 p.m. Remember, 3 p.m. aggravation are very, very important. It is useful for large urticaria. Skin is dry, hot, alternating with gushes of sweat. Swellings after bites. The skin is sore, sensitive, and stinging. Erysipelas, carbuncles. So whatever the skin problem means, it has to be vesicular, but it has to be a puffiness of the part. The part has to puff up. It has to be red, rosy. And what is the pain that the patient will talk of is splinter-like pain. And there won't be always the patient will want something cold application, intolerance of heat will be there, intolerance of touch will be there. So many symptoms coming close to lachesis. Remember, again the animal kingdom, animal counterpart, right? This is also animal, lachesis also. So there's a lot of intolerance of heat, intolerance of touch, which is seen in lachesis also. Okay, so that's what is Epis. Next remedy is arsenic. It's a used remedy, constitutional remedy, but it is useful for hyperpigmentation. This one thing I wanted to tell you. We were talking about macule, hypopigmented, and hyperpigmented. Hypopigmented, I told you remedies like calcarea and silic. Hyperpigmented remedies like arsenic and mercury. These are the two remedies for hyperpigmentation. And arsenic, you know, whatever kind of eruption, it is an exfoliative pathology. Causes a lot of exfoliation. Therefore, arsenic becomes an important remedy for psoriasis. So eruption can be papular, dry, rough, scaly. Remember these three words in arsenic: dry, rough, scaly. And if it is too much, then it is arsenic iode. Remember, arsenic iode. If there is a lot of dry, rough, and scaly, and it goes on increasing, and the patient is hot, think of arsenic iode. If the patient is chilly, think of arsenic. Okay. So worse by cold, worse by stretching. Malignant pustules, lot of offensive discharge coming, which is like cadaverous, which we all know. There's a lot of burning, lot of restlessness, psoriasis, and important. Wet weather aggravation, midnight from cold drink, cold foods, better by heat and head allergy. Very, very. So whenever you see any exfoliative pathology, please think of arsenic. Anything which exfoliates, the skin is coming out, just like kali sulf. Arsenic is also there. Arsenic iode is also for exfoliant. Okay, so don't forget. Silicia. Silicia is yet another remedy, which is a very, very good remedy actually for the skin. Causes a lot of pustular formation, a lot of pus. So silicia can be indicated in macules which are hypopigmented, as I told you, tinea, versicolor tinea alba or pityriasis alba. At the same time, it becomes papules, pustules, acne. Silicia becomes an important remedy. So whenever there is a lot of pus formation and the patient says that my healing is very slow, wounds they don't heal very fast, and small wounds they become pustular, think of silicia. With the chilly person and too much egoistic and too much timidity in appearance in public, too much nervousness, but a lot of ego inside. Okay. So that is silicia. Again, fingers are affected, nails are affected. Cracks at the end of finger, just like petroleum, right? Offensive pus. It promotes expulsion of foreign bodies. Every little injury separates. There are dry fingernails, crippled nails. The nails are not good. I told you three remedies: silicia, thuja, and antimony root for nails. Any affection of nails, think of these three remedies. Keloid growths. Many people develop keloids on the chest here and there. Silicia is an important remedy along with thiocyanamium and graphites. Three remedies for keloids: silicia, graphites, thiocyanate. Maybe in the next lecture I'll tell you the difference of these keloids also. So silicia is for anything which becomes pus very fast. That is very, very important. Scars becoming painful. Fingers are affected. The nails are affected. The nails are not good. They are crippled nails. And also for keloid. So Thuja, whatever the skin problem, it will occur all over the skin or in the anogenital region because it is psychotic mild. So the affection is especially around the anogenital. So there are warts, carbuncles, tubercles, polypi around the anogenital. Therefore, Thuja is also an important role remedy for sexually transmitted diseases like even warts, viral warts because of sexually transmitted. Right? Perspiration is sweetish and strong, just like Caladia. So dry skin, brown spots, zona. So it's good for herpetic eruption. Again, nails are crippled, bitter, and soft. Eruptions only on covered parts. So that's Thuja for you. These are big remedies, so they have small indications of skin, right? Another prime remedy for urticaria, urtica urens, very important, especially after eating sea fish or especially after eating anything from the sea. So itching, blotches, urticaria, burning heat is closely related to epicenter. Bovista, urticaria, nodes of Bovista. Bovista, skin affections because of cosmetics. So don't forget that. Okay, so I'll just show you here. You could see this. See, nostrils, corners of mouth. Again, this is important with the corners of mouth. Lips are chapped. Acne worse in summer due to overuse of cosmetics. Don't forget this. Very important. Acne worse in summer due to overuse of cosmetics. Again, I forgot to put this. Very important in movie story. I think they not come up in movie story. Okay. So that finishes with urticaria, an important remedy for urticaria, right? Then anthracynum. Anthracynum is a very good drug for anthrax or any kind of ulcers or abscess, syphilitic in nature. And the main difference between anthracynum and arsenic is that both have got tremendous burning pains. Both have got tremendous frustration. So burning pains, frustration is similar. But on one side, arsenic is better by warm application, anthracynum is better by cold application. So that is the difference between arsenic and anthracynum and carbuncle. You know what is a carbuncle? Carbuncle is usually a superficial ganglion of the skin, which happens usually in diabetes mellitus, and usually happens where the tissue is very thickly attached to the underneath muscle, like in the back. So carbuncles are more common in the back. I know. I hope you all know what a carbuncle looks like. See this. This is how carbuncle looks. See again back of the neck here. See back of the neck here. Carbuncle infrared. This is how carbuncle looks. Black and blue blisters, dissecting wound, just like arsenic. Remember, very close remedy to arsenic. Intolerable burning is there, insect stings, bad effects of inhaling foul odors. Very important. Succession of boils, just like in syphilis, just like in arnica, just like in tuberculum. Boils coming up, acne coming up one after another. I will just show you here. Look at boils, material medica, and if you see tuberculum. See, crops of Plica polonica. Tuberculum also an important remedy for skin. Plica polonica, that means where the hairs stick to each other. Then you have to cut a hole. It is known as jata. Sadhu Maharaj and sadhus in Himalayas and along the Ganga, you see that they have not taken bath for many days and all their hair becomes tangled and mixed up. That is known as Plica polonica. Crops of small boils, intensely painful, successively appear in the nose. So this is the location of tuberculum, nose. The child or the adult will come and say that inside there are a lot of boils, and whenever I cut them or whenever I break them, greenish pus comes out. So crops of small boils, intensely painful, successively appearing nose, green fitted pus. See, why I am telling you to read Boric and why I am telling you to read Clark is probably at the end of this month. I'm going to take some exams for you. Okay, we are going to take small exams. They are not very big exams, but I'll take exams on MCQ basis. I will send you a MCQ paper. You have to fill up the. There'll be a symptom written and 4 remedies, and I want you to tick mark the right remedy. Okay, so that's why I will give you portion also. What portion you have to read? I will give that portion. You have to study that portion. You have to study the remedy. Okay, mostly from Boric and Fatak, and of course Dubey. These 3 books you have to read. Not Clark. I leave Clark at present. Let's not go too much deeper. But at least these 3 books have to be read, and there will be exam, right? So today is 21st, probably at the end of the month, or maybe next month, the first week, we'll have a 25 or 50 marks MCQ exam, and then maybe later on we'll take a small oral exam also, online. Okay, so that's tuberculin. Okay. Similarly, I wanted to show you syphilinum also. Syphilinum also has the same symptom of boils coming one after another. You must all be knowing it, right? Syphilinum. Succession of abscesses. See, it is written in blue color. And I told you, anything in Boric which is written in italics is the most important symptom. Please don't neglect any symptom of Boric which is given in italics. See in head, what he has written? Falling of the hair. That means it is a very, very important remedy for hair fall. Are you getting it? Falling of hair. Excessive flow of saliva, it comes out of the mouth when sleeping. Again written in blue, again written in italics. Most important symptoms. Just follow Boric blindly. Don't follow Dr. X, Dr. Y, Dr. Z from here and there blindly, but follow Dr. Boric blindly. This is what I will say. Please, if you don't have a Boric at home, please buy a Boric. Beg, borrow, or steal a Boric. You should have a Boric at home. And if you read every one drug per day or 2 drugs per day and try to memorize only these blue colored symptoms, you will become a master in it. Always washing hands. What does this mean? This means obsessive compulsive neurosis, right? And syphilinum is one of the most important ones. Rheumatism of the shoulder joint at the insertion of deltoid. Very, very important symptom. For frozen shoulder is very, very important. So we were talking of succession of abscesses or boils coming one after another. I told you syphilinum is one remedy. Tuberculum is another remedy. Both of them are, what is the common point between syphilinum and tuberculum? They are both nosodes. But there is one more remedy that I will tell you for boils coming one after another. And that is our basic remedy that we did in first year. Touch me not. Why do they call touch me not patient? Don't touch me, don't touch me. Please go away, please go away. What is that remedy? Remedy is called we have to mold against it. Anyway, I just want to tell you this succession of boils coming one after another is also arnica mortem, which is one of our commonest remedy. Arnica is also what? Ecchymosis, blue black spots. Remember that? See, black eye, abscesses, boils. Arnica is also an important remedy for skin and especially symmetrical skin eruptions. Remember that. Don't forget arnica if there is symmetrical skin affection, even vitiligo. I had given arnica to one patient who had symmetrical vitiligo. Whenever he developed vitiligo here, he also developed it here. And it was exactly mirror image. So symmetrical eruptions or symmetrical lesions, think of arnica. Very, very important. Right? So this is what I wanted to tell you. I also wanted to show you. Uh, let's see this big screen of arnica. Acne indurata characterized by symmetry in distribution. See, it is in blue color. See, it is in italics. And crops of small boils. See this. Epithelum silica and also tuberculum and syphilinum. We know all this. So we've got four remedies. If boils come suddenly one after another, think of arnica, syphilinum, tuberculum, and silica. Right? So this is the crops of small boils that I want to tell. So don't forget this. Okay. So we were talking of anthracinum for succession of boils. Right? Next remedy, basilinum. Last time when Dr. Peshwani had taken a lecture on general practice, we had talked of basilinum and we had also talked that it is one of the most important intercurrent remedies. It means either you are doing tellurium and CPR for fungal infection, right? Tellurium and CPR are two important remedies for fungal infection. But for long-standing fungal infection, you have to give basilinum 1 m once a week dose, so that's to remove the tendency for ringworm. So any patient who is complaining of recurrent ringworm or pityriasis or eczema of the eyelids, think of giving basilinum 1 m, one dose, 1 week. Every week for 4 5 weeks, if you give, the tendency to fungal infection will go out. It's very, very important. Next remedy is Bovista. Now, I was telling you about the acne worse in summer due to use of cosmetics. Bovista is like a puff ball. Remember, it is like a fungus. It is like a mushroom puff ball, and it breaks off like it opens like that. So Bovista. So the body of the patient is also like that only. So it is like puff body, and anything which he writes, even with a pen he writes, after some time there will be an impression of it. So blunt instrument leave a deep impression. Urticaria. It's a very, very important remedy for urticaria, eczema, pimples. Urticaria which is worse in morning, worse in bathing. But don't forget that it is important remedy for acne and especially young girls after overuse of cosmetics or foundation or whatever the girls use, right? For this. Very important remedy is Hiparsil. Again, a brother of Cilicia where there's too much tendency to suppuration, pus formation is there, easy bleeding is there, but splinter-like pains are there. And there are four remedies for splinter-like pains: Hiparsil, nitric acid, argentum nitricum, and dolichos. So any patient complaining to you saying that there are splinter-like pains in the affected part, be it throat, be it skin, be it anywhere, think of four remedies: argentum nitricum, dolichos, Hiparsil, and nitric acid. Okay. Again, acne in youth, suppurate with prickly pain. So first remedy, what do we think of in acne also, which are pustular, you think of Hiparsil or you would think of silicia. If it is not too much pain, then you use silica. If there is too much pain, then think of Hiparsil. Unhealthy skin, every little injury suppurate, chapped skin with deep cracks on the hands and feet. Again, location, sensation. Remember, the first time we talked of morphology, elements from location, sensation, modality, and control. Ulcers smelling like old cheese, they are very, very sensitive to touch. Ulcers of Hiparsil with touch, they start bleeding. Hipar and nitric acid are very close remedies for bleeding aggravated by slightest touch and splinter levels. And the typical ulcer of Hiparsil is surrounded by small vesicular eruptions or small pimples, and later on they also break and the ulcer becomes bigger and bigger and bigger. That's how it is, right? So great sensitiveness to slightest touch, cold sores, cannot bear to be uncovered, wants to be wrapped up warmly, good remedy for urticaria, smallpox, many other things, right? So important things you should know of every drug. All the generalities should you know, right? Lead pal, again a very, very important remedy for discolorations remaining after a long time. Very, very important. Imagine you get an injury and there is a discoloration. Nowadays you get this cream called no mark cream, right? No mark cream, where long time discolorations go over. Lead pal is also good. If there is some discoloration remaining after some injury, think of leader point. It's good for ecchymosis, just like arnica and sulfuric acid. And there are red pimples on the forehead and cheeks. It's good remedy for acne, carbuncles. But what is the most important thing is wherever or whatever part is affected, he feels better by icy cold application. Whether it's gout, whether it is rheumatism, whether it's skin, whether it's acne, he feels better by application of cold, icy water. Very well. That's leader. Okay. Calcare itself again a brother of Hepar lot of pus is there, but when pus is mixed with blood, then it is calcare. So if you got big acne and every time you remove the acne, pus comes and a lot of blood also comes out, think of calcare. So a lot of pus, purulent discharge, yellowish scabs, wounds, bruises, unhealthy discharge. Think of calcare. Cicuta. Many people with eczema, there could be a lot of eczema but no itching. And there is a lemon colored crust. Remember the crust of Mesarium. There was a crust and underneath there was a lot of pus. Here there is no pus, but there is a lemon colored crust. There is a lot of itching. Sorry, there is no itching in spite of eczema. So chronic impediment. Think of cicuta. So that more or less finishes today's lecture. It was a quite an exhaustive lecture. I have taken many drugs also. And I want you to please study these books. I want you to go back, read Borik's Materia Medica, Allen's Keynote, Clark's Materia Medica, and Dubé. These four books are very, very important. When you will have exams, I will be normally talking about these remedies only, what remedies we did today. We will be asking questions from these remedies only. With some additional remedies, what I did, tuberculinum, arnica, syphilinum, and all that, which I put in the notes and then send it to you. So don't worry. And I am thinking of taking these small exams at frequent intervals so that we will also tend to study, because normally we get busy in our schedule. Either we get busy with our children and our family, or we get busy with our practice, or we get busy with something else, and the fellowship remains beside. Okay, so I don't want anybody to take this course for granted. I want you to study hard. I want when you pass out, you should feel that yes, I have done something different from what I knew. A person who comes out of fellowship saying that अरे ये तो सब मुझे मालूम था, then I feel that I am a failure. It's not your failure, it is my failure. I want you to suggest, also tell me what you want, what extra things I can do to make this course more interesting to you, more knowledgeable to you. I can bring lots of teachers from all over the world if you want, there's no problem. The important is I want you to show me some interest. Again, I want to repeat that last time only 11 people were there, now there are at least 23 people. Dissertation writing is the most important thing. So to start talking, writing your project from now onwards. There are many people who have not decided the topics. Please decide some topic. There can be a repetition of topic also. There is no problem. Please decide your topic. Go on the internet. Try to find out all the stuff about that topic. That means what now if it's psoriasis. So what is psoriasis? What are the causes of psoriasis? What are the different types of psoriasis? Clinical management and clinical signs and symptoms of psoriasis, allopathic management of psoriasis, homeopathic management of psoriasis. This becomes one part of the dissertation. The second part is the research. That means material and method. That means where you have studied these 30 cases. Have you studied in Dr. Batra's clinics? Have you studied in your clinic? What are the aims and objectives of this study? This is very, very important. Then you write 30 cases. As I have told you, every case should be complete in its form, where the whole case taking format should be there. Analysis, evaluation of the case, repertorization table of the case, prescription should be there for at least 8 months follow-up should be there, and before after photograph should be there. 30 cases in your thesis, 15 mixed cases in your clinical album, and your completed logbook. These three things are the things that you will get for your exam. Please don't forget these three things. One is the thesis containing 30 cases of your own topic. Clinical album containing 15 mixed cases, the same format and the same representation and everything, before after photos, everything. Just that it is called album and mixed cases. And third is your logbook signed by your mentor. I have already sent you the list of your mentors. You are supposed to call them up, talk to them. Maybe you will not be able to meet your mentor now because of Corona, but maybe when the Corona gets over, you can go and meet your people who are in Pune. I have mentioned Dr. Anis Jamadar, who is a senior doctor in Fatima Nagar Clinic in Pune. So please, those who are in Pune, go and meet him, go and talk to him. He's a very helpful, very nice person. and talk to him about your thesis, about what topic you want to take, get your logbook signed from him. If possible, go and attend the clinic, see some patients with him, or any other Pune clinic, whichever you want to. Okay. People who don't have any clinic nearby of Dr. Batra's at present can sit with some local doctor or with some other physician, complete their logbook, and then whenever there are these COVID things are open, you can go to any other clinic of Dr. Batra. We are ready to help you whenever you want, so don't worry, don't take stress of anything. If you have any problems, please ask me. Okay, let me look at some questions. Okay, so there are no questions. Anybody has any questions, please ask me. Remedy for itching without rashes. I think it is the opposite of secretime, that is dolichos. I think dolichos has. We'll just see, Archana. Just wait, because I think wait out of my mind. Let's see. Because we always used to remember also in our exams, itching without eruption and itching with eruption. So I think it's dolichos. See, the general intense itching without eruption. Was that the question that you were asking? Itching without eruption. Yes, Archana. Itchy scalp without dandruff. I don't think of any other remedy at present, but it could be sulfur also. Sulfur is very, very important. Sir, Ishwani sir recommended Bacillin 200 and Bacillin 100 recommended of Bacillin 200. I think whatever is available is good, but normally nozodes have to be given in higher potency, so I would prefer to give it 1 ml once a week. The relationship of medicine is helpful in skin disease. Very, very important. Yes, you're right. Sir, one question again, please guide about syphilis potency in hair loss. See, if you are many a times when you are giving a specific or therapeutics, I will keep it as low potency. So I'll give syphilis 30 or syphilis 200 twice a day for 7 days, for 10 days, something like that, till the hair loss is better. So give it in low potency if you're giving just as therapeutic. Remember. Yeah, Meru, we are going to have a lecture on repertorization also. So just be patient. We'll get some good work. Contact dermatitis or urticaria due to synthetic fibers. For that, Sucheta, I think a proper case taking is required. Remember, for any kind of allergy and allergic eruption, number one remedy is sulfur. Even last time when I taken a lecture, I told you whatever allergies are there, whether it is respiratory allergy, skin allergy, whatever, the most important remedy is sulfur. So think of sulfur for allergies to synthetic fibers. Any more questions? Yeah, one more thing I want to tell you and to request you is that please keep paying your fees properly on the right time on the 5th or 10th of every month. I know for everybody it is little difficult with the corona, but then we are also supposed to maintain a course, we are supposed to maintain an academy. So please let not me remind you again and again about the fees, because I don't like it and it's not a part of my domain to keep on asking you about fees, because there is nobody from accounts to help me, so I am doing that. But please respect this and start paying up your fees. Don't make it lag behind, because then at the end of the year there will be 20, 30,000 and it will be difficult for you to pay. So pay 8 or 9,000, whatever the installment is there regularly, so that it won't be a burden for you later on. So please listen. Okay? And start working on your thesis, start working on your clinical album, start working on your logbook. I've already given you the list of mentors, so please contact your mentors immediately. Try to reach to them. If you're able to travel, please go to the clinic where your mentor is. Try and sit with them, talk to them. At least the first thing is make a phone call and say that I am your student, sir, and I'm from so and so area, and maybe after Corona I would like to visit you. I would like you to teach me this is my topic of thesis, can you help me? Please do this, please do this, at least start this. Okay, okay. So I think we will wind up now if you don't have any questions. Okay, Meru says whenever I give sulfur it causes aggravation, so what do you suggest the potency we need to use? See, if sulfur is causing aggravation, you should try to use water doses. That means put some pills of sulfur 200 or whatever dose you are giving in water, mix it, give half water in the morning, half water in the evening, and keep it repeating every 7 days or 10 days like this, and the aggravation will be less. Or you can also start with LM potency. That's what you okay. So thank you very much, and probably this week or next week we'll arrange another lecture also. And as somebody suggested about repertory, the next lecture will be on repertory. Okay, bye bye. Thank you. Take care. God bless.